All right, so today we're diving deep into something pretty crucial for a lot of you out there, the USMLE.
The USMLE.
Yep, the United States Medical Licensing Examination. And, well, we're zeroing in on what it means specifically for Indian medical graduates.
Those IMGs who are looking at the U.S. for their medical careers.
Exactly. And to get this all sorted out, we've gone through a ton of information, a whole guide, analysis, the works. We wanted to make sure we're giving you guys the stuff that really matters, cutting through all the clutter and making this whole USMLE thing a bit less daunting.
Yeah, it can be a bit overwhelming. But the thing about the USMLE is it's kind of the backbone for IMGs to actually practice in the U.S.
Right. It's the gateway, essentially.
It is. Leads to getting licensed, landing those all-important residency spots. So it really sets the stage for your whole medical career over there.
Okay, so let's break it down a bit. 3 steps, right. What's the deal with each one?
3 steps, yeah. So step 1. Step 1 is all about the fundamentals, those core medical sciences that you need to know. Anatomy, biochemistry, that kind of stuff.
The building blocks.
Exactly. Then step 2, CK comes in. CK standing for clinical knowledge, obviously. So this is where you show you can apply all that foundational knowledge in real-life patient care situations.
Okay, so it gets more practical.
Much more. And then finally, step 3, that's about making sure you're ready to practice independently.
Makes sense. And there's this whole ECFMG certification thing that keeps popping up. What's that all about?
Oh, the ECFMG? That's the Educational Commission for Foreign Medical Graduates. Basically, they make sure your medical degree meets U.S. standards.
Yeah.
It's often a must-do before you can even take the USMLE. Like, it's a prerequisite.
So it's like getting your credentials verified.
Exactly.
All right, so zooming back in on the USMLE itself, why do these exams even exist? What's the point?
It's about having a national standard. They want to make sure that anyone practicing medicine in the U.S., no matter where they got their medical degree, has hit a certain level of knowledge and skill.
So consistency and quality across the board.
Exactly.
Okay, let's dive back into those steps. Step 1, we talked about foundational sciences, and it's pass-fail now. So what exactly gets tested there?
It's all those core preclinical subjects. So you've got anatomy, biochemistry, physiology, pathology, the whole gamut. And with the change to pass-fail, it's really about demonstrating a solid foundation in these principles, not about getting a super high score anymore.
Interesting. So the pressure's off a bit in terms of scores, but the knowledge still has to be there.
Absolutely.
All right, step 2, CK. That's where you apply everything in a clinical setting. What are the main areas to expect?
This is where you really start thinking like a clinician. Surgery, internal medicine, pediatrics, OB/GYN, preventative medicine. It's about taking all that knowledge from step 1 and using it to make those clinical decisions, but still under supervision at this stage.
Still learning the ropes, so to speak. Okay. And step 3, getting ready for solo practice. What's the key difference there?
Step 3 is all about showing you can handle things on your own. So it focuses a lot on patient management, especially in those common outpatient settings. And it builds upon the knowledge you've shown in the previous steps, of course. Plus, you'll actually be in the U.S. when you take this one.
So it all comes together in step 3.
It does.
All right, let's talk money. This is always a big question. How much should people expect to shell out for each step?
All right, so for step 1 and step 2 CK, you're looking at around $680 to $1,020 for each. That's roughly $57,870 to $87,210 Indian rupees.
Quite a bit, yeah.
Step 3 is a little pricier, around $935. That's about 79,942.5 rupees.
Okay, so factor that into your planning for sure. Anything else to keep in mind, cost-wise?
Definitely. Don't forget things like eligibility extensions, rescheduling fees, potential international surcharges for taking the exam abroad. Oh, and the ECFMG certification fee, which is about $160. It all adds up.
Yeah, those extra costs can sneak up on you.
Absolutely.
All right, moving on to the exam format itself. How are these exams structured, and how long do they actually take?
Okay, so step 1 and step 2 CK, those are both one-day exams. Pretty intense, 8 to 9 hours long with a bunch of question blocks. Step 3, on the other hand, that one's spread out over 2 days. You'll have those multiple choice questions, but they also throw in computer-based case simulations where you manage these virtual patients.
2 days, wow, that's a marathon.
It is.
So thinking about the timeline, how long does it typically take an IMG to get through all 3 steps?
It really depends on your study habits and how you prep. But on average, IMGs take 1 to 3 years after graduating to complete the entire USMLE sequence.
So it's a commitment, for sure. We talked a little bit about the ECFMG certification earlier,
Yeah.
and there are different pathways now, right? What's
Yeah.
the thinking behind that?
Yeah. So they got rid of the Step 2 clinical skills exam, and now they've introduced these 6 pathways. It's all about making sure IMGs show they've got the clinical skills and communication abilities needed for the U.S. The pathways just offer some flexibility for people with different educational backgrounds.
So it's more inclusive.
Exactly. And one thing that's pretty important for most of the pathways is passing the OET medicine exam. That's the occupational English test, specifically for medicine. It's all about making sure you can communicate effectively in English in a medical setting.
Makes sense. You got to be able to talk the talk.
Right.
All right, let's shift gears to preparation. If you had to pick some high-yield content areas for each step, what would you say are the most important for IMGs to focus on?
Okay, so step 1, behavioral sciences, biostatistics, neurosciences, those are all important. But pathology, that one's a biggie. It carries a lot of weight.
So pathology for step 1. Got it. What about step 2, CK?
Step 2 CK. You got to be ready for clinical scenarios from all specialties. But internal medicine, that tends to show up a lot. So make sure you're comfortable with that.
Internal medicine. Got it. And step 3?
Step 3, it's all about managing patients in those outpatient settings, remember. So it's pretty broad. General medicine, surgery, pediatrics, OBGYN, psych, ethics, prevention, even biostats. You got to be ready for anything.
Sounds like a lot to cover.
It is.
All right, question types. Is it all just your standard multiple choice questions?
Mostly, yeah. Multiple choice is the main format across all 3 steps.
Yep.
But just so you know, Step 2 CK sometimes throws in questions that are linked to these little case abstracts. And then Step 3, that's where you get those computer-based case simulations we talked about.
Oh, right, those virtual patients.
Exactly. But the good news is there's tons of stuff out there to help you prep. You've got official materials, and then there are popular platforms like UWorld that a lot of people swear by.
So resources are out there, just got to find them. Okay, so you've aced the USMLE. You're in. What kind of career paths can you look at in the U.S.?
Oh, it's wide open. You could go into pretty much any specialty you can think of. Primary care, super specialized surgery, you name it. Plus there are options in academic research, teaching, all sorts of related fields.
So lots of possibilities.
Tons.
And what about the financial side? What kind of salary can you expect?
It really varies depending on what you specialize in and where you end up practicing. But just to give you an idea, the average physician salary in the U.S. is somewhere between $363,000 and $368,000 a year.
That's pretty good.
Yeah, it's not bad. Some specialties, like neurosurgery, tend to be on the higher end, while primary care might be a bit lower. But it's all relative.
Of course. And what about the lifestyle? It's known to be pretty intense, right?
It can be, yeah. Especially during residency, you're looking at work weeks that can be over 50 or 60 hours. So finding that work-life balance is super important. And don't forget, the cost of living varies wildly across the U.S. So that's something to factor into.
Yeah. Location, location, location.
Exactly.
Okay, before I wrap up, how does the USMLE compare to other licensing exams around the world, like in Australia or the UK?
So they all essentially do the same thing, make sure doctors are up to snuff. But the structure, where you take them, the difficulty, it all varies. You've got the USMLE, the Australian Medical Council exam, the UK's PLAB. They each have their own quirks. Some people find the Australian or UK exam structured a bit differently. The USMLE is recognized by the UK's General Medical Council, though, which is interesting. So yeah, it's good to do your research.
Yeah, compare and contrast.
Exactly.
And just briefly, what's the vibe from the current administration in the U.S. when it comes to healthcare and IMGs?
Well, they're pretty focused on making healthcare more affordable and accessible. And they seem pretty supportive of IMGs. They see the value that IMGs bring to the healthcare system, especially in those underserved areas that have trouble attracting doctors. So that's a positive sign.
So bottom line, the USMLE is a huge commitment, but it's the key to practicing medicine in the U.S. if that's your goal.
It is. And
Yeah.
for all you IMGs out there, really make sure you prep thoroughly, stay on top of any changes, and really understand what you're getting into. It'll make the journey a whole lot smoother.
So true. And on that note, here's something to ponder. This is a big step, a big life change. So really think about what draws you to practicing medicine in the U.S. What's that one thing that really resonates with you? And what new questions has this whole deep dive sparked for you? We've just scratched the surface here, but hopefully this gets you thinking and helps you on your path. Thanks for diving deep with us.
Thanks for having me.
All right, that's a wrap.